So I will call the meeting to order. And before we proceed, two things first. One, apologies to Steve Ward for not recognizing last month that was his last meeting. We were under the impression he had one more to go.
Yeah.
And welcoming our newest board member, and Kelly, if you would introduce Kim, please.
Just a moment.
Yeah, take your time.
Well, everyone, I'd like to, for everybody, welcome Kimberly Block to the Hospital Authority. I think she has some good qualities and experience to bring to the table here with us, and so City Council approved her last week, and so we're glad to have you here with us.
Thank you. I appreciate that. Welcome.
Welcome, thank you. Now, we'll get down to the consent agenda. All the following items which concern reports and items of routine nature normally approved by AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all of these items. The consent agenda consists of the discussion, consideration, and action on the following items. Minutes of the monthly finance meeting, April 16. Minutes of the monthly trustee meeting, April 16. Check report, April 10th through May 8th. Do I hear a motion?
I make a motion to approve the consent agenda.
Second.
All right, we have a motion by Jay and a second by Alva. Call roll.
Sell,
Yes.
Randalls,
Yes.
Simon.
Yes.
Brown,
Yes.
Bob.
Yes.
Next we move to the CEO's report. Candace?
All right. Outside of what you have in front of you, I just have a few things. We have made the decision to delay the EPIC project, which is our software project moving forward. A couple of key things, financing being one, but most importantly, our cash position at this time. We just feel that it would threaten our viability if we move forward with this at this time. So we are going to delay it until next year, and we will begin making plans. It was too short. The time frame was just too short for us to be able to do what we need to do to remain solvent, and we will be putting a contingency plan into place. St. Anthony will come up with their IT staff and help us look at our server situation, which is the nail biter for us, is the age of our server room. That's about $1 million or more worth of servers in that room that are aged out. And so we'll look at that to see what we can do to get by, and what we'll do if they start going down, and have a plan in place to mitigate those issues. But we just feel that that's the right thing to do for us at this time. That's kind of where we're at on that. Any questions about that? Comments? Recruiting, still plugging away at recruiting. Don't have any great promising things to tell you right now on that front. I do have a couple of med students, still working on those, which is the long-range plan. But as far as anything short-term, unfortunately, I don't have any great news at this point. So we'll keep plugging away. Today we had 59 to-be 7th graders here for MASH camp. That is a lot of kids to walk in the door. But they were so well behaved. They were in and out of here in just a little over an hour, I think. They tour the hospital, and the departments go through and they explain what their job roles are, the education required, kind of what the pay range would be for earning potential. So it's really, we really enjoy having them here, and they ask good questions, and then they come back. Right now they come back as to-be freshmen, and They are allowed to choose an area that they're more interested in and do some job shadowing and spend, I think it's about 4 hours or so with this to do that. So good stuff. Just wanted to point out upfront collections, Heather, you and your team, great job. This month was a little over $51,000. If you'll remember, we were around in the 30, 35 area for a very long time, so they're hitting that pretty hard, and we appreciate your effort with that. Does anybody have any questions for me?
Okay. Thank you, Candace. We need to approve or disapprove the written report.
I make a motion to approve.
Second.
Myself, motion, Jay Randall, second. That the report be approved. Call the roll.
Randalls,
Yes.
Simon,
Yes.
Brown,
Yes.
Bob,
Yes.
Self.
Yes.
And then the next item I have is the approval, disapproval of Dr. Lawrence's ER contract. Each of you have seen that contract. Is there any discussion related to that contract?
I make a motion to approve Dr. Lynch's ER contract.
Second.
Thank you.
Motion by Jay Randall, second by myself, to approve the contract for Dr. Lawrence ER. Call the roll.
Simon,
Yes.
Brown,
Yes.
Bob,
Yes.
Hannah, Self,
Yes.
Randalls,
Yes.
CFO.
Okay. For the month of April, we posted $1,818,517 worth of charges, which is a $248,445 decrease compared to prior month. Patient days were down 15 to 129 in April compared to 144 in March. And our office visits, our clinic visits, for all of our clinics were down to 1506 compared to 1714. But remember, March was still the flu season, so we're getting more to where our typical flow of patients and stuff are. So that's to be expected, that decrease in patient office visits. Hospital contractuals, less bad debts, and charity care for the month totaled 52.7% of gross patient revenue. We wrote off $102,135 to the collection agency, and we gave away $34,857 in charity care. Our net operating loss for the month of April was $129,699 before sales tax donations, and with that, we ended up losing $45,207 for the month. If you turn over to page 2, looking at the income statement, really there wasn't much changes. The biggest change was sales tax receiving a $16,000 decrease there, as far as that goes. And if we turn over to page 3 or page 4, we can look at the 2 year-to-date numbers. You can see that our revenue is up almost $2.1 million. A lot of that's due to us, one being critical access, but that being with the extra days, patient days, especially in swing bed stuff, really generated the revenue. You can see we're up almost $1.1 million in patient revenue. Overall, we're about $900,000 better off this year than we were last year. We still had a loss of $696,33 compared to a loss last year of $1,593,002. Now there is some, we have not got our final cost report in. There is some more adjustments that we have not made yet on this report yet because we're waiting for them to give the final approval for that. But we submitted that report back to them in February, and we should get an adjustment at that time. And we'll make the adjustments in, but I'm not going to make any adjustments until they make the approvals and stuff. But just to give you an idea, we are doing better. Like I said last month, the critical access has made a difference for us. There's a couple of other things that we're working on, like rural health clinic and 340B plans that will also help more with us as well. So it's all going in the right direction. It just takes a little bit of time to get everything into place. Page 5 shows you that cash is still pretty tight. We still have $40,000 at the end of April. But one of the good things is, as you'll see later on in the graph, we're actually paid down our accounts payable line another couple of days. So even though cash is still tight, we're slowly digging ourselves out of our tables as well. Next couple of pages are accounts receivable. You can see it decreased by a little over $200,000 last month. see kind of the aging out there. Pages 8 and 9 is, of course, your balance sheet. And then pages 10 through 13 is all of our statistical summaries, year to date and the last 5 years side by side. And really, on the very first page, you can see that our patient days is where we've seen the hugest increase, and most of that is due to the swing bed. Because last year, at this time, we were projecting 474 total patient days for swing bed. This year, we're projecting 1,320. So almost 1,000, well, a little, almost 900 more days in swing bed this year compared to last year. So that's all positive. Otherwise, everything else was pretty normal month as far as volume-wise. Some departments up, some down, but really nothing else that was out of the ordinary. Is there any question I can answer?
Okay, thank you, Kevin. Dr. Self, medical staff?
We met on the 9th, and we approved 3 appointments and 1 appointment. The first one is Carolyn Holmby, MD, is reappointment to courtesy staff for pathology, and I'll make a motion that we approve the reappointment.
Second.
A motion and a second to approve the reappointment for Dr. Holmby.
Brown,
Yes.
Sell,
Yes.
Bob,
Yes.
Randalls,
Yes.
Simon.
Yes.
And I make a motion for the reappointment to allied staff for Brian Nutter, advanced practice RN.
Second.
Motion by Dr. Self, second by Ayla, to approve the reappointment to allied staff of Brian Nutter.
Bob,
Yes.
Sell,
Yes.
Randalls,
Yes.
Simon.
Yes.
Brown.
Yes.
And I understand that Dr. Whitson, he's a pulmonologist, and mean that he's open to do an outreach clinic here starting this fall. Great guy, known him a long time. So I make a motion for the appointment to courtesy staff of Brian Whitson, MD.
Second.
We have a motion by Dr. Self, second by his cohort down there, and
Sell,
Minutes reflect
Yes.
your cohort.
Randalls,
Yes.
Simon.
Yes.
Brown,
yes.
Bob.
Yes.
Now, I have to challenge the rest of the board. I personally had a colonoscopy and cataract surgery this month. So,
Which one do you want us to get?
well, you're going to have to beat it, you know?
Oh,
That's awesome. Did they treat you right?
challenge accepted.
As far as he remembers.
That's a record. That's not better.
Kevin, back to you on Quantum.
Okay, well, I think, I'm pretty sure that we told you last board meeting that we did get surveyed by DNV, and if not, we did get surveyed, and we did submit the correction plan back to them, like a couple of weeks ago. We did have 6 deficiencies, which they weren't major, but we went ahead and got the corrections in, and that seemed to go well. We put all the corrections that we said that we were going to implement into our SQSS system, which is our quality initiative system, and we're going to monitor those going forward. Otherwise, out of QAPI, we did look over some different departments and stuff. Some departments did not have initiatives, or their initiatives were at 100% for 6 months, so they created new initiatives, and so they started those up as well. But otherwise, everything else in the QAPI itself, everything met criteria that we're looking for going forward for our quality standard. And like I said, the 6 items we got written up for that we're going to monitor, continuing on for the next 6 months to make sure that they're implementing stuff for the next survey. So everything's going well there.
Any questions to Kevin? Moving on, improvement of patient care.
You have a copy of the validation calendar in your book, and there were several contracts reviewed. All of them were compliant, one was no longer applicable, so that one is being deleted. of your book, approval, disapproval of the organ sharing network policy, and also the TB risk assessment policy.
And this is something that we have to do on an annual basis. There was no changes to either one of them, but it's just something that we need as a board for you guys to approve. That says that you guys know that we do organ sharing network. We have that set up as well as TB risk, we assess that. So that's really what we're asking.
I make a motion we approve those.
Second.
A motion by Dr. Self, second by Dave Randall, to approve the organ sharing network life share policy. Call roll.
Randalls,
Yes.
Simon,
Yes.
Brown,
Yes.
Bob,
Yes.
Self.
Yes.
And we got one other, the TB.
I make a motion we approve the TB risk assessment policy.
Second.
Motion by Jay Randall, second by Dr. Self, to approve the TB risk assessment policy. Call roll.
Simon,
Yes.
Brown,
Yes.
Bob,
Yes.
Self,
Yes.
Randalls.
Yes.
Convalescent home report. David, let's go.
Kelly.
Let's see how this goes. The cash operating balance, or operating cash balance for April was $35,178. That's 3.6 days of operating expenses, excluding depreciation. Accounts receivable had a balance of $706,789, which was decreased by $5,423 during the month of April. Accounts payable was $270,504. That represents 47.2 days of operating expenses. Gross patient revenue for the convalescent home was $296,982. It's about a $27,000 decrease from as compared to March. And total days were 1,534 compared to 1,665 in March. Contractuals, 5.5% of gross patient revenue, and operating expenses, excluding salaries, benefits, and depreciation for April were $137,266, which is a $7,700 increase versus March. Salaries and wages were $124,171, which is a decrease of $5,350 compared to the prior month. And our net operating, it says income,
Yeah,
but it
it's
was a
loss.
loss. $13,483. And total net was a loss of $13,478. Look at our year-to-date on page 3. We're at just over $3 million in operating revenue, which is down about $300,000 from last year. Our expenses are up about $20,000 versus last year, and our net income is $10,000 loss year to date. Looks like for May and June, we should see a decline in our contractual expenses with agency nurses or aides, and we have seen an increase in census. We're up to about, I think by tomorrow we'll be around 54. So things are seem to be picking up a little bit. Been in this transition, I've had a lot of conversations with staff members, trying to really get a feel for what's going on, what's good, what's bad, what do we need to work on, and all those kind of things. And we'll be having a pretty heavy emphasis on, number one, reducing our dependency on agency, which has been a priority for a while, but we're going to work on some strategies to try and bring that about. As we looked at the June schedule for shifts, we're going to see probably about a 30% reduction, 30 to 40% reduction in agency from May to June, and hopefully, maybe by the time that summer's over with, we'll have made even more progress on that. I have a meeting tomorrow evening with all of the nursing staff to talk about not only that, but also since Senate Bill 280 was passed, that's going to be a $23 a day increase in reimbursement from Medicaid for our residents that are on Medicaid. That's going to bring the Medicaid rate up to almost what we're charging per patient day. And so, but a lot of those dollars are tied to quality initiatives for improving patient care. So we'll be looking at falls, prevention, pressure ulcer management, antipsychs, rehospitalizations, and one other category. I don't have it on the top of my head, I didn't write it down, but one other category for quality improvement that we're going to start working on some initiatives to make sure that as they're going with pay for performance. So if you do a good job, they're going to pay you more. So those are the areas that the state's identified for higher reimbursement, and so that's what we're going to focus on. Happy to try to answer any questions.
Any questions about the nursing home? Kelly, you're up again.
Well, the homestead had another net profit in April with $12,425 income over expenses. It's down a little bit from previous months. It was mostly because we saw a pretty good reduction in census. The number of residents who got sick and ended up having to leave and not able to come back between March and April was pretty high, probably about the highest I've ever seen in any month or two period since I've been there. Even so, revenue was still pretty decent, over almost $64,000 total revenue. Expenses were managed pretty well. We were at $51,488 for April. The year-to-date numbers were at $738,431 for revenue. And $548,344 for expenses, for a net income of $190,087. That's a little over $60,000 more than last year, same time. So things are still going pretty good at the homestead. I do know that as Christy and I transitioned leadership, the census, like I said, had been down, but as we were going through that transition, people were signing rental agreements. So Christy's got a few more residents over there this month than she did last month, and so things are shaping up. We did trade a couple though, so I guess that happens from time to time. But so it was kind of, we were able to get through all of the routines and everything, and probably have to do a little bit more of that both ways, both nursing home routines for end of the month as well as homestead routines for end of month. So, but I think transition's going pretty well. As far as projects are concerned at the homestead, they did complete the walk-in cooler and freezer project. The cooler project and freezer project are complete, but the carpentry work to finish everything out, the new doorways and whatnot is not yet finished. The rains have been a pretty good challenge for that particular project because we are getting some water in the building while we're dealing with that project. The big super 2-bedroom conversion last week was coming along pretty good. The flooring was going in last week, and so they're getting close to being able to have an open house for that project. And as Dr. Brown mentioned beforehand, the pond is full. I'm happy to try to answer any questions you guys might have.
Anything for Kelly on the homestead?
Foundation report.
How about the foundation?
I'll report on our scholarship that we give, the Alva Hospital Authority Scholarship. The board had voted in earlier this year to give away 2 $1,000 scholarships, and this year the recipients were Landry Gaddy, an Alva High student, and Brenner Clark, who's from Burlington. We had earlier in the year taken time to redefine our criteria for being eligible for those awards, and the emphasis being on a healthcare career and an interest that would primarily serve Alva and the surrounding area. We, historically get a lot of applications for, nothing against any of these professions, but with it being the Hospital Authority Scholarship, we didn't want those scholarships being awarded necessarily to someone going into chiropractics or optometry or something like that, and we were really looking to focus our preference on folks going into either physician programs or nursing programs or other allied health services that are going to be supporting services in our community at our hospital. So I think Brenner is going into nursing, Landry's going into medicine, and so and both of them with an interest in returning to rural health care and things of that nature. So 2 $1,000 scholarships there, and that is all I have to report for the foundation.
Any questions of Kelly about foundation? Thank you, Kelly. We don't have a city council representative, so we have no debate there.
I guess Kelly can do that report.
Is there anything we need to know about the city council?
Probably. We approved Kim Baugh to be on the hospital authority. We are getting ready to have budget hearings in the next couple of weeks so that we can pass our budget for the fiscal year. And we did have kind of an update on the pool, and that there will be whenever we have the budget hearings, there will be a public hearing to discuss financing and funding for the pool. It's going to be open this year, if you hadn't heard. It's going to be open. It just didn't open up Memorial Day weekend, and frankly, with the way the weather was, it's probably all right.
We're down to the chair's report. The only thing I want to mention is that due to a number of people having conflicts with the June 18 date for the next board meeting, we've pushed that a week to the 25th. Anyone have any new business to bring up? Hearing none, I declare we are adjourned.